Hi, Assalamualaikum. I respected two panels, Dr. Suhana Aiman and Dr. Maisara Shari, who were experts in this field. My name is Muhammad Shazani bin Suhaimi from SR2436S2, and this is my proposal defense video. So basically, this is the overview of my presentation today. So let's dig into the title. So my proposal was entitled The Comparative Study of Acute Effect of Spot Massage Therapy on Delayed Onset Muscle Soreness DOMS in Hamstring Group among UITM Shah Alam FSR male students. Now let's get into the introduction. So what is DOMS? From Zhang et al. 2022 define DOMS as skeletal muscle pain or discomfort after performing unfamiliar activity, which typically peak 1 to 3 days post-exercise. And DOMS develop through microscopic damage and inflammation in the deep fascia. Winstrop et al. In 2016 found eccentric exercise peak DOMS 1 to 2 days post-exercise, and also DOMS categorized as muscle strain type 1. Statistics shows that hamstring exercise like Nordic hamstring exercise and single leg Romanian deadlift beneficial for lowering injury in hamstring up to 51% for Nordic hamstring itself. However, for single leg Romanian deadlift, it was proven beneficial for hamstring and also the erector spinae as active stabilizer compared to the other variation of deadlift. Kengafat et al. In 2016 divided uh, spot massage into three techniques, which is the effleurage, kneading, and also vibration. So next is the problem statement of my proposal. The first one is the fear of pain, which a significant barrier preventing people from engaging in the workout. The second problem statement is inconsistent result due to methodology gaps and subjective measure to quantify the DOMS. For example, Zainuddin et al. Use arm-to-arm comparison model, which is one arm receiving treatment and another arm is a control. Behran et al. Only observe DOMS by using pin scale without looking into the markers, other markers such as the range of motion, strength, and also the functionality. The third one is unclear benefit of massage on DOMS, and especially on the hamstring group. A study shows that spot massage can effectively improve hamstring flexibility and reduce pain, but no differences in hamstring strength. But this study is focusing on hamstring injury population, which cannot be generalized for healthy people. Next, the purpose of the study is to identify the how spot massage therapy can be used to treat DOMS and give practical insight to athlete and healthcare professional regarding how to utilize spot massage on DOMS. So next is the research question. So research question number one, what is the effect of acute massage therapy on DOMS in hamstring group among UITM Shah Alam FSR student? Number two, what is the effect of non-treatment on DOMS in hamstring group among UITM Shah Alam FSR student? This is question number three, what is the effect of spot massage therapy in range of motion on DOMS hamstring group among UITM Shah Alam FSR student? And number four, what is the differences between effect of acute sports massage therapy on non-treatment on DOMS in hamstring group among UITM Shah Alam FSR students? So slide number 10 is the research objective, which is I'm not going into deep because we're mirroring the research question. So next one is the research hypothesis. For the null hypothesis, there is no significant differences of spot massage therapy on DOMS in hamstring group between UATM Shah Alam FSR male students. Slide number 12, what is the significance study? So effective massage technique may help to reduce kinesiophobia and muscle soreness, which may influence sports enthusiasts to keep progress overload and manage muscle soreness as well. Next is the study help to understanding how spot massage influence DOMS in specific muscle groups might help to develop evidence-based technique for improving muscle recovery, especially for rehab population. And lastly, the managing DOMS might help athletes to train more effective and perform at higher level. And also the coaching staff might utilize various type of training program. The delimitation was straightforward. Specific muscle group which is only observed on hamstring while the other muscles might come out with a different outcome. Standardized of exercise protocol. Participant only performing the same exercise protocol while other variation of intensity, load and frequency was not be observed. And it was short-term effect only, which is to look at the acute effect, while the long-term effect of the massage was not being observed. And the limitation is cost. A study from Zainuddin et al. In 2005 used a Lefrotron spectrophotometer to monitor the plasma creatine kinase activity, which is relatively expensive to be operate. And the last one is the sample size, only focusing on UiTM Shala FSRM student. In terms of gender and spreading, generalizing might be inaccurate. So the slide number 14 is what is the most operational term in this study. So delay onset muscle soreness, DOMS, is a muscle pain, typically peak 24 to 72 hours post-exercise. Acute is referred to a condition or illness that rapid onset on a short duration. Effleurage, technique performing from distal to proximal sequence. And kneading is a massage technique that rhythmic lifting and rolling the muscle and also the tissues. And the last one is the vibration, which is the rhythmic shaking or trembling movement to the muscles, which can help to relax and stimulate the tissues. Now let's begin into the literature review. The first one is anatomy and function of the hamstring muscles group. So generally, the hamstring is a particular muscle group, which is consists of three heads, which is semimembranosus, semimembranosus, and also the bicep femoris, which are responsible for knee flexion and hip extension. Bicep femoris head helps to the dynamic movement of the knee joint stability and facilitate in mobility or for smooth and controlled movement, for example, during walking or running. And muscle overload, muscle fatigue, and muscle strength imbalance were the key factors that contributing to the hamstring injuries. Next is the massage therapy, help increase local circulation. A study shows that there was a measurable indicator such as the skin temperature changes and the superficial hyperemia indicate the increasing in blood flow near the surface of the skin. However, Davis et al. Found that Swedish massage might helpful to reduce blood pressure compared to trigger point and spot massage therapy, which suggesting that health condition matter before receiving spot massage treatment. And the last one is the studies from the Yoon et al. That shows the increased arterial pressure for quicker muscle recovery due to mechanical pressure, reduction in skin temperature and resting due to regulate blood flow, and generating low intensity electrical stimulation of afferent nerve to regulate heart rate and blood output. Next is the effectiveness of various intervention on DOMS. There are three comparisons between spot massage therapy, post-exercise static stretching, and cryostimulation. From the three comparisons, spot massage shows 13% the reduction of soreness, but no changes in range of motion. Post-exercise static stretching cannot prevent DOMS, and dynamic static stretching is superior than static stretching due to vasodilation, which promote better blood flow. Next, cryostimulation seems effectively reduce DOMS by addressing inflammation response very well, but it was not suitable for certain health issues due to extreme exposed to the cool temperature. The next related study is DOM is not a direct indicator of muscle growth. A study emphasized three major factors for muscle growth: mechanical tension, metabolic stress, and also the muscle damage, showing that muscle damage is not the only sign of muscle growth. Another study by Flan et al. Shows no difference in muscle growth for people with gradually increased exercise intensity versus people who damaging initial exercise bulk group. And here is the literature review summarization which related to this study and might help to observe valuable findings. Next, we go into the methodology. And this is the conceptual framework. Okay, now is the research design is quasi-experimental. The sampling technique is purposive sampling since I will pick up any FSR male students in UiTM Shah Alam with sampling size of 30 people using G-Power software, and the population is UiTM Shah Alam FSR male students. Here is the result from G-Power to determine the sample size. It was the same as the previous study. Now, let's jump into the instrumentation. So the Cybex prone leg curl machine is used to perform leg curl exercise because it provides control environment to perform the knee flexion exercise. Next is the visual analog scale, VAS, which is a pain scale from 0 to 10, from no pain until unbearable pain, will be recorded immediately after 24 and 48 hours post-exercise protocol. Next is the goniometer, which to measure the range of motion of the knee joint angles before the exercise as the baseline and after the exercise. The last one is the massage technique, which is the sport massage technique. Next is the inclusion and exclusion. The first inclusion, participant must be male gender. They must be from FSR UITM Shah Alam, age between 18 to 25 years old, healthy without any chronic injuries or musculoskeletal disease, and must provide informed consent to participate in the study. And the exclusion are very clear. Participant with musculoskeletal injury or any medical condition that contraindicate for sport massage therapy or strenuous exercise is not eligible for the study. Next, allergic to sunflower oil, which is needed to use as the lubricant during massage, and participant who receive previous massage therapy and use of medication may also affect the findings since they may alter the physiological changes in the study. And last but not least, unable or unwillingly to participate or follow up the study. Next is the treatment or intervention of the study. Based on the previous study, the sport massage therapist must be a licensed measurer with at least level 1 certificate. The first step is FRH for 4 minutes. Next is the kneading technique for the three head of the hamstring for 8 minutes. And it will be finishing by vibration technique for 2 minutes. Then continue for the other leg. And this is the exercise protocol, which previous study used the exercise intensity between 75 to 77% of 1 RM, which is in the hypertrophy range based on the guideline from ACSM. Now is the data collection flowchart. The first one is the ethical approval, which is really important for ethical standards and protect the participants' rights and well-being. Next is the brief procedure so that the participants will get the idea about the study. Next one is the consent form and the PARQ form to ensure that participants are fit to perform the exercise. Uh, Next is the randomized assignment for treatment group and control group, which is purely only by chance. Baseline measurement is taken as pre-data collection. Then the exercise protocol is given for both group. After that, the intervention given for sports massage group and no intervention for control group. And after that, then we'll be following by post-data collection, data analysis, and interpret, and also the report. For data analysis, the taken data such as the pain scale and the range of motion will be analyzed by using the independent t-test due to the comparison for this study. So that is all for my proposal defense. Thank you so much for listening. Have a good day.